So a very important question too, but this time is to Dr. Bashir Tawouli. And this is a question. Imaging findings with COVID distribution but negative lab tests. How do we go about this? I'm
Yeah.
actually copying the question exactly from the attendee. So how we handle this, Dr. Tawouli?
Okay, so I think I mentioned this briefly in my talk. So there have been a few instances where the RT-PCR test is negative, and remember again, sensitivity is not 100%. It really depends how early you are in the disease. It could be too early or too late, and it can be also sampling the wrong area. So there's a lot of issues with the test. It's not perfect, and there's actually, this is evolving actually. We used to do not so long ago nasopharyngeal swabs. I think soon there will be also saliva tests. It's coming up. I think FDA just approved actually a saliva test that can be done at home eventually. So the sensitivity numbers may change over time. But when you have a clear, like during the pandemic, somebody who has clear pictures of COVID-19 negative RT-PCR, this will be called in our hospital PUI, person under investigation. So that means they get into the category of non-COVID-19 confirmed, but they stay in this category like waiting for a diagnosis. And what we do usually, we repeat the test, right? So, and I think Keith answered to that as well. I think they repeat it within 24, 48 hours. But if that second test is still negative, I think they still stay. I'm not sure what happens to the PUIs who become negative. Can you tell us, Keith? I'm not sure.
Well, so that it's not the most straightforward issue. So this issue of repeated negative tests in people that you are certain have COVID-19 happens not infrequently. So typically they will go off isolation unless a clinician feels strongly about that, feels strongly about it. And what I have done in that situation is actually spoken with infection control and said, I really think this person has it despite having 2 or 3 negative tests. I'd like them to be isolated. And my advice to everybody would be, if it looks like COVID and it smells like COVID, even if the tests are negative, even if multiple tests are negative, it can still be COVID.
Great, thank you very much, both, for answering this question.